Okay, so here we are looking at the arteries and veins of the head and neck. So first off, let's just go through a few of these. First off, this right here is going to be the internal jugular vein. Now, one of the things I don't like about this model is that they did not put the external jugular vein. It would be coming off like this, but they don't have an external jugular vein on this. They only show you an internal jugular vein. So I'm really not that thrilled with that. In any case, the internal and external jugular veins, okay, are going to come off of this right here, which is the subclavian vein. Oh, excuse me. Subclavian vein. So that's the subclavian vein. That's the right subclavian vein. This is the right subclavian artery. Okay. Then if we look right here, this is the right common carotid. So this is the right common carotid artery. Well, if that's the right common carotid artery, this has to be the left common carotid artery. This is the left internal jugular vein. Now, the common carotid artery is going to go up on both sides, on both the right and left side, and it's going to bifurcate. As you may remember, bifurcate means to split into two. Now, how do you determine which of these, this one or this one, is the external and which is the internal? Well, the external is the one that has the branch that comes off of it. So you see there's a branch coming off of this right here. So therefore, if this is a branch coming off of this vessel right here must be the external carotid artery, and then this other branch in the background is the internal carotid artery. Okay, now those are both in red. Here on the left side, this is the left subclavian artery. This is the left subclavian vein. And I said to you on a prior video that what I look for is I look for the internal jugular vein, and I just draw on the medial side of the internal jugular vein, I draw a line straight down. Therefore, from here to here is going to be this vessel right here is the left brachiocephalic vein. And then from here to here is the right brachiocephalic vein. So if I put a marker here, a sticker there, it's the right brachiocephalic vein. Put a sticker here, it's the left brachiocephalic vein. Put a sticker here, this is the left subclavian vein. This right here would be the left internal jugular vein. And then this right here is going to be the superior vena cava. So again, from here to here is going to be the left subclavian vein. From here to here is the left brachiocephalic vein. And from here to down to there is going to be the superior vena cava. This vessel right here in the center of the mediastinum, that is going to be the thoracic aorta. If I say identify the red vessel here in the lung, that's going to be the pulmonary vein. If I point to the blue one, any one of the blue ones, that's going to be the left pulmonary artery. Remember, all arteries are red, all veins are blue, except for pulmonary. If I go down, this is just another view of it. Okay, this is just showing you that this right here has the branch coming off of it. So remember, if it has a branch coming off of it, this has to be the external carotid artery, the left, and this has to be the left internal carotid artery. And remember, the internal carotid artery supplies blood to the brain. External is going to be more superficial. Now, if we look right here, this is the arch of the aorta. Remember, there are three branches off of the arch of the aorta. Remember your ABCs: A, aorta; B, brachiocephalic trunk; C, common carotid, specifically left common carotid; and S, subclavian. So remember your A, B, C's. So this right here is the superior vena cava. This we said was aorta, so I'm just going to put an A there for aorta. The first branch off of the aorta, this one right there, is going to be the brachiocephalic trunk. The next branch off of that, this right here, is going to be the left common carotid. So again, it goes up, left common carotid. And then the third one that goes up and then goes back here a bit more posterior is going to be the subclavian. And again, the subclavian artery. Okay. Next, what my rule of thumb is, because this is not necessarily the best model for giving us a landmark. I like to use the muscles as a landmark, but it is what it is. Here's the head of the femur. If I put a sticker around this area right here where the head of the femur is, I'm looking for axillary. Okay. So if I say identify the red, axillary artery; identify the blue, axillary vein. Now, if I say identify the artery here, now notice I'm in the diaphysis. Okay, the shaft of the femur. Therefore, if I ask for the identify the red vessel, you're going to look for or put down brachial artery. Okay. Now let's just go back to the veins again because we've done this already. This is the internal jugular vein on the left side. This is the internal jugular vein on the right side. So all of this is the internal jugular vein. This one here on the outside is the external jugular vein. So again, internal jugular vein and external jugular vein. I told you guys earlier that this is the internal jugular vein. From there to there is all of this right here. Let's just use a different color. All of this in here would be the right brachiocephalic vein. Well, if this right here is the internal jugular vein on the left side, and this right here would be the end of it, this would be the left brachiocephalic vein. And then from here to here would be the superior vena cava. So let's just do it real quick. Identify the, here we go, the blue vessel. That would be external jugular vein. Identify the blue vessel. Internal jugular vein. Identify the blue vessel. Brachiocephalic vein. Identify the blue vessel. Superior vena cava. Identify the blue vessel. Left brachiocephalic vein. Identify the blue vessel. Left subclavian vein. Identify the red vessel. Aorta, arch of aorta. Identify red vessel here. That would be brachiocephalic trunk. Identify the red vessel here or here is going to be the left common carotid. Identify the red vessel here or here, left subclavian artery. Identify red vessel here, axillary artery. Identify red vessel here, brachial artery. And those are on the left, obviously. If I say identify the blue vessel, if I say identify the blue vessel here, that is the right pulmonary artery. Identify the red vessel here. Identify red vessel there is going to be the right pulmonary vein. This would be the left pulmonary artery and left pulmonary vein. Remember, all arteries are red, all veins are blue, except for pulmonary. This would be the right subclavian vein. This is the right subclavian artery. Again, there's the head of the femur, so we're going to call that red there. We're going to call it the axillary artery. And this is going to be the brachial artery. So as we look down, we see that this is going to be the radial vein. This is going to be the ulnar. This is the ulnar vein. This is going to be the ulnar artery. Now, how do we know? My rule of thumb is always look for the thumb, ironically. The thumb is always on the radial side. So the thumb is always on the radial side. So that means this has to be the radial artery. This has to be radial artery, radial vein in blue. This has to be the ulnar artery, and this has to be the ulnar vein in blue. Okay. So remember, I always look for the thumb. Radius is always on the thumb side, so these have to be radial. Therefore, the other side must be ulnar. Notice that the hand is pronated on this side, so it makes it a little bit more difficult to ask it on that side. Now, as we go down to the next model, and I'll actually go back up for just a second, you'll see that there's a little arch here. Okay, that little arch there. That's actually the diaphragm, a dome-shaped structure, okay, is the diaphragm. Just very quickly, if I say identify the organ, left kidney, identify the organ, right kidney, identify the organ, liver, identify the organ, spleen. Okay, so here's just another view. If I say identify the muscle or identify the organ here, any part along there, I could put it up there, I could put it here, I could put it here. That would be diaphragm. Pretty straightforward. If I put identify the organ here, that would be the liver. This is the kidney, and the spleen. Okay. Next, the blue vessel here is the inferior vena cava. Inferior vena cava. This right here in red is going to be the abdominal aorta. Now remember, if it's superior to the diaphragm, it's the thoracic aorta. So that's why if we looked back at our previous model up here, this is the thoracic aorta up here because it's superior to the diaphragm. If we're inferior to the diaphragm, like we are right here, this has to be the abdominal aorta. Okay. Now remember, the first branch after the diaphragm, the first branch off of the aorta after the diaphragm is going to be this right here. It's just going to be the celiac trunk. So I'll just write that down for you. So it's the celiac trunk. Okay. Next, the next branch that goes up and goes to the liver is going to be the hepatic artery. Now, remember, hepatic means liver. You've probably heard the term hepatitis, so that's how you can remember that. Then we have this other, so that's one branch off of the celiac trunk. The second branch off of the celiac trunk is this one right here, which is going to be the splenic artery because it's going directly to the spleen. Makes sense. And then we have this artery that's going up and around right there, and that's the left gastric artery. So again, that's the left gastric artery. Next, we have coming off of here, off of the abdominal aorta, is going to be the renal artery because it's going to the kidney. And remember, the other word for kidney is renal. You're not going to really use that very often, but may see renal disease, but renal is not used as often as the word kidney. If I say identify the blue vessel here, it's going to be left renal vein, red left renal artery, red right renal artery, blue right renal vein. Okay. These branches that go down like this in red, they're heading down to the gonads, the testes and ovaries. Therefore, this vessel right here on the right side is going to be the right gonadal artery. This on the left side is going to be the left gonadal artery. Now, you'll notice here there's a letter H, okay, or at least the letter H right there. That's going to this right here, that vessel right there. And that vessel right there is going to be the superior mesenteric artery. The way I do it, and you don't have to do it this way, it's just the way I do it. I always say celiac trunk, superior mesenteric artery, and then I find the inferior mesenteric artery. So it's 1, 1, and 1. There's only one celiac trunk, there's only one superior mesenteric artery, and only one inferior mesenteric artery. There are no rights or lefts with that. But the one that goes right and left here is going to be the gonadal arteries, right and left gonadal arteries. Okay. As we go down the abdominal aorta, it then bifurcates. We have the left and the right common iliac arteries. Then we have the internal iliac artery and the external iliac artery. Remember, external means superficial, internal means deep. So here would be the right common iliac, internal iliac artery, external iliac artery. If we did the veins, what's really nice, the veins match up pretty well. If this is the common iliac artery, this is the common iliac vein. External iliac artery, internal iliac artery, internal iliac vein. So let's try this again. This is the common iliac artery, common iliac vein. Let's just do the veins be straight there. That's going to be the internal iliac vein. This is the external iliac vein. Okay, same thing on the other side. Internal iliac vein, external iliac vein, common iliac vein. Now, as we go down, once you pass this region, now there's no actual indication of the inguinal ligament here, but we're going to use that bone as the example. We have the this right here, remember, is the external iliac vein, and this is the external iliac artery. Once it passes that area, which is where the inguinal ligament would be, it then changes its name. So the name is now going to be the femoral artery and the femoral vein. And here's just another, again, it's a lot of the same